All right, and we are live. Today, I have a special guest on our live stream, Dr. Steve Grcevich. We're talking about mental health today. Steve, will you introduce yourself and talk a little bit about your background and what it is you do?
Sure, absolutely, Nils. Well, by training, I am a physician and a child and adolescent psychiatrist. So, for about the last 30 years, I've been involved with private practice. I teach at a couple of different medical schools. Had been involved with some research where we're looking at like safety and side effect issues of a lot of the commonly prescribed medications for kids and teens with mental health issues. And more importantly, I guess, for the last 17 years, been involved with leading an organization called Key Ministry, where we work with churches around the country and around the world to help them welcome and include families of kids with all types of disability.
So you wear a number of hats, and you and I have gotten to know each other over the last few years around online church circles, and it's been such a privilege to be a part of Key Ministry over the last 5 years or so, and I've learned so much from you and the great need that exists in the church. But you and I were talking last week, and that's where I felt this urgent need to bring this to conversation with everyone, because I think this affects, and we're specifically going to be talking about churches for the most part here, but I think this affects businesses. This affects that what's happening here with the coronavirus. I think we're talking a lot about the economy effects, but there are a lot more effects here that we've got to be thinking about. So, Steve, you shared with me a stat, and maybe let's start with that last week about people in isolation and what's been proven around those studies.
Well, as folks started talking about this a week and a half ago, I thought I'd do a little dive into the research literature in terms of figuring out, well, what do we know about people who have experienced quarantine before, or the social isolation that's now being practiced across the country. And so there's not a ton of, there was some research looking at physicians and healthcare professionals in Toronto who had been quarantined for a period, I think on average 10 days, about 15 years ago when there was an outbreak of the SARS virus. And when they went and looked at some of the data in the short term, they found that the folks who were quarantined were significantly more likely to develop depression, were 4 times more likely to have symptoms of post-traumatic stress compared to their colleagues in the hospital who hadn't been quarantined. And one of the most fascinating things was that when they looked at them 3 years later, it actually turns out that they had almost a 5-fold greater risk of experiencing symptoms of depression that long after the fact, compared to, again, other, comparable people in the hospital who didn't need to be quarantined. And that was looking at a 10-day period of time. I mean, you start looking at, some of the situations where, people, this is maybe going on for a number of weeks, or the social isolation perhaps for a couple of months in some places. We're in like uncharted waters. And so there isn't a whole lot out there to tell us what the potential impacts of this are going to be. But, looking at this with my psychiatrist hat on, it's not going to be good.
Yeah. So, Steve, as you think about, so what I just heard and processed is that study is from a 10-day period. We're now likely looking at potentially a 100-day period. I mean, we really don't know how long this is going to go, but we can take those stats and know that's likely going to be the case, if not even more significant impact long-term from this. What would you say to church leaders? How should they be responding right now to just help in this situation? What should they be doing?
Okay, well, obviously, this is something that we're talking about on a regular basis. And if folks wanted to go to keyministry.org and take a look at our blog post today on the coming mental health epidemic that's going to follow sort of this initial wave of COVID-19 cases, we have a lot of different ideas there. But when I think about some different ways that churches can be helpful, it does seem like when you look at some of the research that's out there, it was the loss of social connection that was one of the contributing factors to the mental health issues that a lot of these folks experienced when they were under quarantine. And that when you look at the research that's out there in the medical literature that shows that there are specific benefits in terms of physical health and mental health associated with being part of a church, it's the social network that goes along with being part of the church and being integrated into a community that seems to play the protective role. So that, I thought it was wonderful yesterday to see, our own church, churches where, teammates on our ministry, other friends of mine attend, seeing how many places we're putting their worship services online. That's wonderful.
Yeah.
What you need to do this week is that you have to think about how you're going to put the entire social infrastructure of your church online, meaning, your Christian education for children and adults, how you put your small groups online, how do you put your Bible studies online, and how do you use online resources to be able to help people to work together and identify opportunities to serve folks within the church and in the larger community. And that's where you have a tremendous amount of wisdom to be able to, contribute to this discussion and show churches exactly how to do that.
Well, I appreciate that compliment. It's and you and I've had these conversations for years of the opportunity that we see online. The reality though too, in that I found, I remember when we first moved to New York, I thought we're going to just be the family that does church online, and within 2 months, not even 2 months, we realized, no, we want to do church face to face, that we have that craving and that need. So I think the reality is we have an understanding that this is not as good as face to face, but in this season, we've got to do the best we can. And what people don't just need, and what I just heard you say, is just a broadcast to them once a week. They need community happening as much as possible online. Am I hearing that right?
Yeah, that's absolutely correct. I don't remember whether it was you or Jay Cranda that talked about the notion that online community is real community.
Yeah.
And I think that for folks where this is like their first foray into doing things like Zoom, they fail to appreciate how impactful it can potentially be. And we had a wonderful woman like Sandra Peoples, who was on staff with our ministry for 2 years before she and I were ever physically together in the same place. And while again, it's really important, and folks find it to be, very energizing and a blessing when you have the opportunity to get together in the physical presence of the people that online. Being able to interact through tools like the one that we're using today. This morning I was we were doing an orientation for the staff in my practice because everything that we do is all online as of this morning. And, I was dragging and kicking certain people from our group into the 21st century, trying to teach them how to use Zoom and some of these other sorts of tools. But you could see that the further we got into the meeting, like the possibilities, were kind of going off in folks' brains about how they could use this as a tool. That, they might not think about organizing a therapy group, but they could pull together 2 or 3 kids that they're taking care of in similar issues, and talk about some strategies and give them some ideas for supporting each other. So that I think that, you kind of, you have to do it to be able to get it. But I think folks are going to find that the extent to which they can use technology to be able to stay connected will be very helpful over the next couple of months. Kids come about this naturally, and the time that they're spending on Snapchat and Instagram and other apps, combined with the online connections that they're going to have with their teachers and people from school. I'm thinking that our adults are going to have a much more difficult time coping with some of this stuff than the kids, because the kids already have a significant social network online, and a lot of adults aren't accustomed to communicating in this way.
Yeah, that's a good thought process. to understand. My kids actually started Zoom this morning for their classes. Both of my kids did. My second grader tested it with her class yesterday, and it was fun to see her light up as she was able to interact with her friends and teachers after a week. I remember talking to my wife this morning, and I was like, I can't believe it's been a week. And she said, it hasn't even been a full week because it feels like it's been a year, so this quarantine isolation just feels like it goes on. I mean, it just feels like it's extended. Here's my thought, Steve. If I'm a church or I'm a business or a youth group, now you've got to have a little bit of admin, especially as you get into teenagers, but I would set up a dedicated Zoom line for your church, and it's $14.99 is the full paid version. If you go to what is it, TechSoup, you can get a half off version as a nonprofit, but don't wait for that process. It's $15 for a month, and just leave that on. Let that be your church lobby all the time, and have somebody in there where you literally just say, hey, if you want to hang out with people from church, just get on our Zoom line. This is our Zoom link. And you always have a place to go and be with other people. What are your thoughts on that idea?
I think that's a fabulous idea. And, there are lots of different places where this can be a benefit. So that, you think about like the mental health epidemic that we already have, and I'm anticipating that about 2 to 3 weeks after we see our peak in terms of folks getting admitted to the hospital with coronavirus, we're going to see a peak of folks being admitted or coming into emergency rooms after overdoses or suicide attempts, or contacting various crisis lines. And what folks need to understand is that the mental health system isn't remotely prepared to deal with any of this stuff. Wow. And so that one of the places where I think that the church is probably best positioned to be the church, especially for our adult population, is that that there's a tremendous role for the church to be able to provide companionship and support through this. So that while they're buying the Zoom line for their Zoom room where people from the church can hang out, I encourage churches to think about having a Zoom account for every counselor or pastor or person on your staff who's doing counseling. Maybe have a number of Zoom accounts if your church has a Stephen ministry for folks to be able to use that to stay connected with people. In churches, again, where you have I know churches that have grief groups. There are churches that have other sorts of special interest groups, so that, you might be buying, 10 or 20 or 50 Zoom accounts, depending upon the size of your church. But having that technology available to people is going to be critically important over the next month or two, as we all struggle to get through this.
So Zoom, as I'm thinking from a technology standpoint, is probably the most important technology for the next couple of months for churches and really probably any organization, especially when it comes to mental health and engaging. What are some signs, Steve, that if somebody's maybe potentially dealing with, or there's somebody in their church that might be dealing with PTSD or depression or those kind of signs that may be early to even be thoughtful about and aware of?
Yeah, so some of the things that you would be looking for that would suggest that folks need to be paying attention to this issue with depression would be significant physical changes over a period of weeks or a month or two, changes in your sleep pattern, changes in your eating habits or your weight, changes in your energy level, a loss of ability to concentrate or issues with focus and memory, feeling sad or unhappy, the majority of the time, the majority of days, losing interest in stuff that you usually enjoy, so that if folks, if you yourself are experiencing, 4 or 5 of those signs, or other people who are, it would be important to reach out to your primary care physician, to reach out to a counselor at your church or other counselors that and during this time, it is important that people who have a need for help, use the available technologies to seek it out. Like I got a message this morning from, someone who works with a mental health board in a county, 50 miles removed from us, where they're developing an inventory of all of the mental health practices that have the capacity to see new people and initiate with the process online. So again, I think that during this time, and it's not just things like, for example, small groups, and Christian education. The ability, to be able to, have somebody from the church who can, call, use email, text, chat with different folks, who may be alone, is something that would be very beneficial. Some enterprising church might collect up a bunch of iPads and have them delivered to one of these senior centers or nursing homes, because those are the folks, because of their health risks, who are actually struggling most with some of the social distancing and the restrictions that many places have put on visitation. So that having the ability to work with someone within those facilities who can help, some of our seniors understand the technology, and use that to maintain connectedness with their families and with people from their church, that will all be extraordinarily helpful in the weeks ahead.
Yeah, that's so good. And I think too, one of the just call outs that I need to understand, because my mom has been trying to get on, we using the Facebook portal. I'm apt to be impatient with people that are struggling with technology, because I live in it every day. And so because they need it, be patient with them, help them slowly navigate and get up and going. But there's nothing like that, and Steve, we were talking about this before. Is this audio or is this video and audio? Connecting with you via video is so much more personal than just audio. And so getting that FaceTime is a really valuable tool.
Yeah, it's fascinating. I'll give you a specific example of this. So that, on Tuesday mornings, like, I get together with guys from a couple of different churches at our tennis club for a Bible study. And so last week I had volunteered, well, if any of you guys are interested, we can use my Zoom room. And, I'd offered it, and they're like, no. We're going to go ahead and, like, we'll do a conference call.
Yep.
Because at 8 senior members of the group. But, so they went ahead and did that this past week. But Sunday I got a message from the two leaders saying, that, can we use Zoom? It wasn't the same talking on the phone as being able to, to see everyone and interact with everyone in real time. And part of why I like the Zoom technology, again, about half of my patients did their follow-up appointments through Zoom last week. No one had a problem.
Yes.
And there, it was very simple to use. And we didn't have to send out an announcement or do any coaching for folks, how to use the technology, after going ahead and sending them their appointment link in an email.
Yeah, that's so good. I think there's so many reasons I love Zoom as well, but it's the ease of use. And so there's some free platforms out there, and people often want to try to just get by with that free platform. Right now, when it comes to mental health, spend the $15 to help engage in a more personal way. And Zoom is just the best in this space. It makes it so easy. I've got a couple of messages here that have come in. DJ Chuang shared, and DJ, this is a topic that's very near and dear to his heart. But he says there's a new free solution, prayermeeting.com. And so I'm not aware of that tool, but if DJ recommends it, I recommend it as well. Yep. And then James Poulter, one of my friends from London, shared that they've been donating old spare devices to senior adults in their congregation. I love that, and helping them, and already having Zoom on there would be such a great aspect, and maybe even having YouTube app downloaded if you're giving them an iPad. And I would just say, my kids have used those Amazon Kindle Fire tablets, and my grandmother uses that to video conference with my kids. That's a $40 device. These don't have to be expensive devices. My kids are also both using Chromebooks that are under $100 for their school with Zoom. So this technology doesn't have to be expensive to be functional in this time. Steve, as churches start thinking beyond coronavirus, and what what's going to happen. Before I jump into this question, though, James Poulter just shared that Facebook portal is on sale right now. We bought those at Christmas for all the grandparents, my parents, my mom and my dad, and my in-laws, and even the aunts and uncles. And we are doing TV to TV. It is the easiest to use video conferencing platform that we've seen, but it's kind of one-to-one. But with kids, especially, it is a fantastic tool. So I highly recommend those Facebook portal devices. And we got my mom because we knew she couldn't figure out how to connect it to her TV. We got her one of those ones that are on a stand, and she can use it. So if she can use it, you can use it. But Steve, I want to get to, as we start thinking through beyond coronavirus and beyond isolation, and you saying that mental health industry isn't going to be ready for the effects of this. How can churches try to be thinking ahead in this rather than being reactive after the fact?
So I think that, you want to be able, as we talked about before, to have in place the infrastructure for folks to be able to connect and communicate with one another, thinking forward. There are some things that, again, I think that churches can be doing to prepare so that after we get off today, we've been part of a group that's been working with the Office of Faith-Based Partnerships for the federal government through Department of Health and Human Services to communicate various resources or to share resources, that the government has already developed with churches to help them do a better job of supporting families. One of the things I would keep an eye open for would be opportunities, for example, to train your staff online in mental health first aid, so that we know that, in large parts of the country, the first place people are going to turn to when they're in a crisis is to their church. And so there are a number of congregations that we've worked with where one of the things that was very important was training like the frontline staff. And I mean, in addition to like pastors and people who are on staff, like training the receptionist to answer who's answering the phones, like the person who's sitting at like the front desk during the church, and to provide them with the training to be able to respond appropriately when someone is kind who needs some support. There's a wonderful guy, a pastor, he's out in Las Vegas, named Jermaine Alberti, who was one of the guys who actually developed the mental health first aid course. And he has come in and he's done some consulting with different churches that we've worked with where, again, that they were going through and training their frontline staff. To the extent that you can, train and prepare and support and resource people who are involved in Stephen's ministry to be able to do peer counseling, that would be helpful. I know that the large church in our community was involved in starting sort of a separate nonprofit biblical counseling practice, and they have all of their resources and are being able to serve people online. So being intentional at this time and reaching out to, to folks out in the private community, be they biblical or Christian counselors, be they mental health professionals in your community, that this is a great time to think about initiating some of those relationships so that when folks come in and you start seeing these needs emerge over the coming weeks, that there's a specific resource or that there are places that churches can turn to when folks have needs that exceed what typically the church would be able to support or address.
Well, that's so good. I think, and I just want to encourage everybody to go, and I'm going to put it back here on the screen. Let's see here. Go to keyministry.org and get on the email list, get on, the social media channels there. This is a time to lean in and Key Ministry resources, and there's tons of stuff on the site and resources available. But this is something churches need to start being ahead of. And what I'm hearing, Steve, is that it almost feels like two things that churches need to be intentional now and probably be ministering to people in a very tangible way around these topics now. Also be preparing their staff and their lead volunteers like Stephen Ministry leaders around these specific issues, and then be prepared after the fact around, every front door point of contact, how to engage in a very intentional way. This is a complex issue. Steve, go ahead.
Yeah. So, this is also sort of like the mother of all evangelism and outreach opportunities, for churches. And so like a couple of other things, like with more and more places putting content online in recent weeks. Lifeway Research with Ed Stetzer had done a big study looking at mental health issues regarding church a couple of years ago. And one of the things that they found, that families who were impacted by mental health concerns, what they most wanted from their church was for their pastors to talk about it from the pulpit on Sunday morning. And so that, during this time, thinking about having a message, maybe, pertaining to things like, well, what does Scripture teach us about coping with anxiety would be something that would be beneficial. Something as simple as like during the pastoral prayer, there was a church that we were at where, the morning after we trained them, the pastor came out and started the service saying, like, welcome to blah, blah, blah church. I'd like to start off today by praying for anybody here who's struggling with depression. If you want to look this up online on their Vimeo page, there's a place that we work with here in Cleveland area called Cuyahoga Valley Church that absolutely knocked this out of the park. And one of the things that they had created, based upon data from the Lifeway study that Stetzer did, that more than half of the folks in the larger community who are unchurched believe that people with mental health conditions won't be welcome at church. One of the things that they did was a specific short video for their people to share on Facebook, specifically to invite folks that they knew in the community who were struggling with issues. And so the guy, it started off like, I'm Rick Duncan, I'm the founding pastor of Cuyahoga Valley Church, and I want to expressly welcome anyone whose family is struggling with mental health issues. Yeah. We know what this is like. My father was a pastor. He struggled with depression. We're here to care for and support you. And so that, with everybody putting this content online and with folks encouraging people to share, one of the ways that churches can think about using this as an evangelism and outreach tool, are incorporating some specific comments and statements and talking about themes that folks, while they're isolated, can specifically think about, people that they know, from work, in their neighborhood, family members who may be more vulnerable to struggling with issues, and can share through their different social media platforms that type of content that's being put together by churches.
Yeah, that's so good. So I think for pastors to be looking out for those resources that are out, and just making, highlighting and finding those resources to share them with your congregation. You don't have to create everything. A lot of stuff is already out there for you to use, but you've got to be intentional in this area. Steve, one of the things that I want to lean into for you and kind of as we wrap up this conversation is pastors are just as likely to get depression. Pastors are just as likely, and the weight they feel right now is heavy. So I'd love for you to speak to pastors. Before you do that, though, I want to share one of the pastors here in New York City. That's one of my favorite guys, is a pastor named John Tyson, and he's a great follower on both Twitter and Instagram. But this is what he tweeted yesterday, and I love this, and I think it speaks to the heart of a lot of pastors right now. He said, "I'm not going to tell you our service today will be awesome and unmissable, or best online service that will change your life. I was sick and the sermon was just okay. In fact, I have found this online stuff sad and hard. Preaching to a camera is not what I was made for. I'm going to take time today and mourn the loss of a way of life and ministry I deeply loved. Being with my people, a daily prayer room with kids running around, filled altars with tears and prayer, awkward side hugs in the lobby, greeting at the door. But mark my words, tomorrow I'll set my heart, lean into a new reality, embrace the opportunity, leverage technology, build the platforms, get a black belt in using Zoom for pastoral care, all the online things. I'll lead and love with all my might into the unknown. And I think that's a message that, boy, I think so many pastors are feeling. And I love, too, that he's like, look, I'm mourning this, yet I'm going to lean in just as well. But, Steve, I think pastors, though, are this is a heavy time for them, and they're likely experiencing the same isolation. How can they be making sure they're taking care of themselves in this time?
Well, the statistics I've seen suggest that at any given time, probably around 20% of pastors are wrestling with depression. But in addition,
that's not an isolation time.
No, I mean, it's 10% of the general population, so that the rate is probably about double, like what you would see in the general population. And you think about all the additional, again, like the stressors that they're under. It's really weird, speaking to an empty room. You have the issue in a lot of places, like a lot of our smaller churches don't have technology available. They depend on the collection plate. The pastor depends upon the money in that collection plate, to pay their rent, to feed his family, to cover their health insurance. I mean, there are some very big time stressors. And so I'll tell you a little bit about something that we're doing that I think would be a wonderful idea, using technology for pastors to support one another. One of the things our organization does, we put on the largest disability ministry conference every year in the country, Inclusion Fusion Live. And we were scheduled to do that the last weekend in Cleveland. And because of these circumstances, needed to cancel. And, we had 73 speakers who were lined up to come. And one of the things that's really helpful, I think, to people about those types of events, is the opportunity to be able to have time to interact with and talk with one another. So that one of the things that I'm planning to do tonight is to use my personal Zoom room and open it up for a couple of hours for any of the people who are planning to speak at our conference. You know what? We want to hang out, talk about ideas, that we may be busy. Who knows who's going to be dropping in at any given point in time, but it's a way of offering encouragement and support to one another. So that, if I'm a pastor, I would think about sending emails out to some guys who they knew from seminary, or, other guys that they know, who they've met with and worked together with, in their own communities, and say, maybe an hour a week, or a couple times a week, we hang out. One time we pray for one another. We hang out, we share ideas. By sharing the Zoom link with other pastors, maybe guys from smaller churches, it's to your brothers in the ministry, this tool that you can then use and turn around and share with your own people to stay connected. So I think that there are ways that pastors can equip one another using technology and provide, and make themselves available to provide this kind of mutual encouragement and support during a very difficult time.
Yeah, I love that. Your stats are eye-opening in this season. So we've got to all be intentional. And I would encourage you, if you're a pastor, if you're not a pastor watching this, help your pastor right now. Your pastor needs to be ministered to, for the congregation to be thoughtful, and even the financial side. I mean, there's a lot of layers to this of the weight that they're feeling of needing to both provide for their family in these uncertain times, as well as minister to their congregation and community in a desperate time. And so that's a lot of weight that a pastor is going through right now. And so the more you can minister to your pastor, the better. Steve, as we wrap up this conversation, any final thoughts around mental health during this time that you'd want to share?
Yeah, a couple of things coming back to what we talked about before. Again, I think that peer support is going to be really essential. And I think that there's never been a better time for churches to think about starting up, mental health specific, faith-based support groups. And there are two outstanding organizations that we work with who have models for this. One is Fresh Hope, based out of Omaha, Nebraska. And really interesting organization. It was started by a guy, Brad Hafes, who was a pastor of the largest Missouri Synod Lutheran church in the country, who lost his job after he had a mental health crisis and ended up in a psychiatric hospital. And so that they have developed mental health support model based upon 6 specific biblical principles. There's another wonderful organization called Mental Health Grace Alliance out of Waco, Texas, that was started by Joe Padilla, who's a Baptist pastor whose family had struggled with mental health issues, and Matt Stanford, a guy, he used to be a tenured neuropsychology professor at Baylor, who's now leading a place called the Hope and Healing Institute in Houston that's doing some wonderful things in terms of supporting the needs of churches in their area around mental health. But the Grace Alliance has several different types of groups that are time limited specifically to anywhere between 10 and 16 weeks. And so if you're looking for something in the short run, to be able to support folks, that they have some wonderful resources. And both of their organizations have all of their training available online, in video form for folks who may feel called at this time to lead those groups. So again, I think it's a fabulous time. I would, check out either, Fresh Hope or Mental Health Grace Alliance, and definitely make use of some of the resources that they have available to churches that are looking to do group support.
So good, Steve. Thanks so much for the wisdom, insights. I'd love to make this a regular thing, and as we continue to navigate these days, and share this with others. So if you are watching this, and I would encourage you to share this conversation. It's on YouTube, LinkedIn, Facebook. It's across the board out there. Share this with somebody that you feel like needs to hear it. These are important conversations to have, and lean into Key Ministry during this time. And Steve, how can other than the website, how can people connect with you?
Steve at keyministry.org would work. They can follow me. It's on Twitter. It's Dr. as in Dr. Grcevich, Grcevich. And we have Key Ministry has 2 different Facebook platforms. We have the Key Ministry platform is specifically for pastors, ministry leaders, church folk. We have a platform called Not Alone, which is specifically for parents and family members of folks with disabilities. And we have all kinds of support resources that are specific, on the one site for churches and on the other site for families. So we'd be happy for folks to follow us there too.
Yeah, love that. So go look up those sites, connect on social media, email Steve if you want to make that personal connection. Steve, thanks for being available and willing to share with us today. We'll see you guys on the next live stream.
Thanks, Nils.